Good evening. My name is Dr. Catherine Caronia, and I am the Designated Institutional Officer and Senior Vice President of Academic Affairs and Chief Academic Officer for Catholic Health Services of Long Island. Welcome to our 26th graduation ceremony. Certainly a very different celebration than what we would have anticipated coming into this academic year, and certainly different than we could have ever imagined when you joined us for orientation at the beginning of your training here at Good Samaritan Hospital Medical Center. However, nonetheless, just as monumental an achievement and one that we would like to celebrate and acknowledge for each of you and your families. Our program will begin with a few words from our local and system leadership, but first we will begin with a prayer from the Most Reverend Bishop John Baris from the Diocese of Rockville Center.
I'd like to congratulate our Catholic Health Services medical education graduates and your families. I am so grateful for the sacrifices you have made to serve Jesus Christ and the mission of mercy of our Holy Catholic Church expressed in Catholic health care. I'm also so grateful, too, for the way you've embraced the power and mystery of the cross of Jesus Christ in these COVID-19 times of trauma and death. I'm so very grateful to you, and now I pray for you. Father, Son, and Holy Spirit, we ask your blessings upon your Catholic Health Services, medical education graduates, their families, and all their colleagues. We ask that the Holy Spirit may lead you and guide you. May the tongues of flame give you great strength and fortitude, give you great conviction in your vocation to serve the Church and all of humanity. And may Almighty God bless you, the Father, and the Son, and the Holy Spirit. Amen. God bless you all.
Thank you, Bishop Baris, for the beautiful blessing. Today, you take a big step in accepting power known only to an elite group. With your white coat and your diplomas, NPI numbers, medical licenses, DEA numbers, stethoscope, and knowledge acquired over the last 2 to 4 years, you enter today a life of new and vast privilege. You may not have noticed your power or have recognized it over the last few years, and you may not have felt powerful or privileged. Certainly not when you were filling out endless billing forms and swallowing crazy rules and requirements, struggling through hard days of too many tasks. But know this, in return for your years of learning and your dedication to a life of service, and your willingness to take an oath to that duty, society will give you access and rights that it gives to no one else. Society will allow you to hear secrets from frightened human beings that are too scared to tell anyone else. Society permits you to use drugs and instruments that can do great harm, as well as great good, and that in the hands of others would be weapons. Society will give you special titles and space of privilege. Society will let you build walls and write rules. Throughout your lives, you as physicians will meet people and families at their happiest moments and at their saddest. You will meet them every day, every hour. They will be in disguise. They will be in disguise as a new mother afraid to touch her preemie on the ventilator, as the construction worker too embarrassed to admit that he didn't hear a word you just said after "it might be cancer," as the alcoholic bottoming out who was the handsome champion of his soccer team and dreamed of being an architect someday, or perhaps disguised the child over whom you tower, or the 90-year-old grandmother over whom you tower, disguised as the man who would prefer to know and he who prefers not to know, or disguised as the man who wants you to call him Bill and the man who prefers to be called Mr. Smith. The rules of medicine are not in the hands of the nameless power, not the people who make the rules, the policies, the governmental officials, the accrediting bodies. It is in your hands. What is at stake here may seem a small thing in the face of the enormous healthcare world that you have just joined, the ever-changing healthcare systems. The cost may seem like a nickel to the $2.6 trillion industry, but is what really matters. It is all that matters. It is the person, the individual, the patient, the poet, the writer, the adventurer, the frightened soul, the wandering mind, the learned mind, the husband, the wife, the son, the daughter. That is who matters in the moment. And in the moment, it is all about choice. You have a magical opportunity. You have the opportunity to decide. You make the choice. You can read the rule book, and someday even write the rule book. Decide. Yes, you can hide behind protocols and policies. Yes, you can say we when you mean I. Yes, you can lock the door. Say, sorry, your 30 minutes are up. You decide, because you can also unlock that door. You can ask, shall I call you Bill or Mr. Smith? Would you like to be alone with your family now? Is there something else that I can do for you? Decide. You can read the rules, the book on how to complete a full history and physical, perform the complex surgical intervention, treat the 60-year-old construction worker with back pain, resuscitate the infant brought in cold and blue, or how to treat the alcoholic with DTs. Or you could say, pardon me. Pardon this unwelcome interruption in your lives. Thank you for inviting me to help. Thank you for trusting me to be a part of your life. Now what else can I do for you? Be the ongoing change that the medical community needs. It is not all about medications, surgical techniques, and the latest and greatest in tools of the trade. It is the human interaction and the dignity that each of you can bestow upon those who seek your help. This is what individuals, families, patients remember, and we all play a part. We are so proud of the physicians you have all become. Maintain the humanistic qualities that brought you into medicine to begin with. Only you can decide. It is your choice. You are our future, healthcare's future. What I have witnessed in each and every one of you throughout your training, and most recently through the COVID-19 pandemic of 2020, affirms that healthcare is in good hands, with you at the helm. Actually in great hands, and you should all be very proud of what you have accomplished, the care that you provided and the sensitivity and compassion that you exhibited. You have all acted incredibly as skilled physicians, professionals, and individuals. Good Samaritan Hospital thanks you. Congratulations to each of you, and God bless you and your families always. Now it is my honor to introduce Dr. Alan Garci, President and CEO of Catholic Health Services of Long Island.
Thank you, Kathy. I want to congratulate all of you for what you've accomplished in recent years. I know how hard you've worked. I haven't forgotten my own residency. And you should all be very proud of what you've accomplished. If you're married, I want to thank your families for their forbearance in putting up with your work schedule. I want to make two comments today. The first is that I hope your completion of residency marks the beginning of a lifetime of learning. In the 1960s, the dean of the Johns Hopkins University School of Medicine used to address the incoming first-year medical students with the following statement: half of what we teach you over the next 4 years will be proven wrong in the course of your careers. Now, it's not quite that bad anymore, but it's still probably 10 or 20%, not to mention all the unimaginable things that you will learn in the course of your careers that are not known today. So please read your journals, attend rounds, go to professional meetings. Not only are these things intellectually stimulating, these will ensure that you are able to provide high quality care. And last but not least, a very wise person once said, "No one cares how much you know until they know how much you care. So please keep that in mind. Thank you for your service to Good Samaritan Hospital. I wish you the best of luck in your careers. And now let me introduce Ruth Hennessy, the President and Chief Administrative Officer of Good Samaritan Hospital.
Thank you, Dr. Garci. I would like to wish a special congratulations to our 2020 graduates from all of us here at Good Samaritan Hospital Medical Center. Like many people across the country, these last several months have been unlike anything any of us have ever experienced. But unlike many others your age, you didn't spend that time home from school or working remotely. You were here, right in the midst of the greatest health crisis of our generation. Simply calling you essential would be an understatement of what you've accomplished. And you didn't just live through it, you rose to the occasion. When there was need, you answered the call with a resounding response. Regardless of your areas of expertise and years of experience, you were there for us when we needed you the most. And for that, I will forever be grateful to this graduating class. I'm sure there are things that you have seen and experienced over the past several months that will stick with you for the rest of your careers. However, in that same vein, I hope that every time you hear "Here Comes the Sun" or any Beatles song for that matter, that you can take a moment and be proud of the fact that you were part of the team that helped to treat and discharge more than 1,200 COVID patients. So now, as you prepare for a new stage in your career and a new set of challenges, take comfort in knowing that you can do anything. You've already battled and survived a global pandemic, but there will be times when you're not sure if you can take on the world. And on those days, I would ask that you think back and remember all of your friends and family here at Good Sam, because we will never forget you and what you've done for our medical center. Thank you and good luck. Now I'm pleased to introduce Catholic Health Services Executive Vice President and Chief Clinical Officer, Dr. Patrick OShaughnessy.
Thank you, Ruth, and thank you for this incredible opportunity to be part of this magnificent event, and congratulations to the Good Samaritan graduating class of 2020. While the events of COVID-19 have us socially distanced, it remains so important to take time to recognize and celebrate your collective tremendous set of achievements. First and foremost, special thanks to your loved ones who supported you throughout your residency to get you all to this point. I know I would not be where I am today as well if it were not for the sacrifices and support my family provided to me. And what a wonderful program you were all blessed to be accepted into here at Good Samaritan. Let's take a moment to thank your Chief Academic Officer, Dr. Kathy Caronia, and all the incredible faculty and clinical staff that educated and supported you all during your residency training. Now, colleagues, and I can call you colleagues, I would not come to such an event as this without a gift. No, I did not bring a check and a card, but I do have something to offer all of you that I will hope you will value, and that is advice. Now, I'm not Tony Roberts, but I feel I can offer you some pointers that can help you along on your careers. First, some clinical advice, and likely even more important following that is advice about life in general. You see, it feels like yesterday I was sitting where you are, and this year marks my 18th year since graduating emergency medicine residency training. Yes, it goes that fast. So let me share some pearls in the hope that some of this sticks in those beautiful minds upon leaving Good Samaritan and starting your careers. Number one, embrace team-based care. Dr. Atul Gawande, a national leader in quality and safety and writer, wrote a famous article in the New Yorker a few years back regarding the need for more team-based care. We need less cowgirls and cowboys and more pit crews. More team-based care. Less of me and more of we. So I challenge you all, watch an Indy pit crew, watch aircraft carrier flight deck operations, watch a well-organized code being run in an ED. When performed correctly in this fashion, it is seamless, effective, almost musical, like a symphony. You will serve your future patients well if you work in collaborative teams, each person bringing some degree of expertise to the table, but the synergy and overall output of the team is nonlinear and magnified beyond any one person's capabilities. Number 2, embrace the humanity of your profession. Never lose sight of what it is you all are doing. That patient is not just an interesting case. You're caring for someone's grandpa, wife, aunt, son. I will stress for you all, healthcare is called healthcare for a reason. Many times in your careers, you may question what you're doing. For me as an ER physician, I used to always ask, is this really an emergency? Does this patient really need to see me right now? Remember, you're treating a human being, the human condition, the human person, the whole being. Don't lose sight of that. Many times you may be that last person of hope, and they are there seeking your help. Let me share a brief story about what I really learned in emergency medicine residency training. Always look beyond the chief complaint. Number 3, second-guessing your chosen profession. Let me reassure you all that you have invested wisely in pursuing a career in medicine, and especially for choosing to train with us here at Good Samaritan. Population and population growth has grown tremendously over the past decade, and certainly over the past 100 years. 83 million growth annually at a rate of 1.1%. Global population has grown from 1 billion in 1800 to 7.6 billion in 2018. And predictive models say we're going to surpass 11.2 billion by this year, 2020. Population growth rate continues to increase between 23 and 25%. And newly and growing aged people with chronic diseases continue to grow as well. 39 million people were 65 years or older. And by 2030, there'll be 72 million seniors, amounting to nearly 20% of the population. And guess what? They will all need healthcare services, services that you will provide as physicians. To maintain current levels of care, which are largely not ideal, as we all know, primary care levels must increase by over 60%. Healthy Planet 2020 predicts over a 50,000 shortage of PCPs by this year, 2020. What's my point? Despite what you're all reading about with the challenges of the U.S. healthcare field, you all chose wisely and have chosen career paths that will be gratifying, fulfilling, and needed for many, many years to come. Remember the quote, "If it were easy, everyone would be a doctor." This is the best job in the world, despite everything, because of everything. Last piece of clinical advice. Healthcare operates in a VUCA environment. What does that mean? It means you have to innovate, adapt, and overcome. Benjamin Franklin was quoted as saying, "If you fail to plan, then plan to fail." I learned this well from my colleagues at the U.S. Army War College and even some time spent with the U.S. Navy recently. What is a VUCA environment and how do we succeed in an environment like this? Well, V is volatility. Expect the unexpected. Prepare for unexpected, and high reliability science can help you adapt to that environment. U, uncertainty. Change can happen fast. Be prepared for it. Always have a plan B, a plan C, and a plan D. C, complexity. Healthcare is complex. It's high risk and tightly coupled. Teamwork, as I mentioned before, and support when all known limitations are exceeded. Ask for help. Work together. A, ambiguity. Sometimes no precedents exist, which we call the unknown unknowns, right? So again, multiple contingency planning, and remember this, patients do not always read the textbooks. If nothing else, COVID-19 has reminded us all of this quite painfully. Now the life advice. You're all type A overachievers, I get it. Yes, that helped you get where you are now. But remember, the race never ends. So be mindful to balance life and career work, especially now as you start your careers as attending physicians post-residency training. Many of us, myself included, have passed on recreational fun, time with friends or family to support work and career growth. But don't keep pushing these things off for tomorrow. For as it has been quoted, if you pile up enough tomorrows, you'll find you're left with nothing but a lot of empty yesterdays. Work-life balance and prioritization is critical for long-term happiness and fulfillment. Prioritize all you have to do, and remember what Jim Collins said in Good to Great. If you have more than 3 priorities, you don't have any. The key is time management. So learn to prioritize, and it's okay to say no sometimes to things that don't align in your immediate priority index. Wherever you are, make sure you are truly there. Shut down distractions, focus on the moment, and enjoy that moment. Cell phones, tablets, there's a constant barrage of information, much of which can wait, some of which is actually meaningless. Weed that out. Save time for creativity and imagination. Albert Einstein was quoted as saying, "Imagination is more important than knowledge, for knowledge is limited to all that we know and understand, while imagination embraces the entire world and all there will ever be to know and understand." So save time for being creative and imagining. Think it's silly? Steve Jobs, Bill Gates, Elon Musk all hold time away from all distractions to simply focus on creativity and what could be rather than there is already. In conclusion, embrace and reflect back on all that you've learned in the past and be ready to build upon that platform and embrace your journeys to become our next generation of physicians, our future healers. Continue to learn, and while amassing great knowledge and advancing your careers are important, I implore you to embrace these pearls I have shared with you today. Don't be a cowgirl or a cowboy. Work in collaborative teams. Embrace humanity and truly care for your patients. Don't second-guess your career. Commit to it, but be fearless in the pursuit of what sets your soul on fire. Learn how to not only survive, but thrive in a VUCA healthcare space. Balance work with life. Prioritize, and it's okay to say no. Be truly present wherever you are and eliminate distractions and manage your time effectively. Continue to learn, but save time to imagine as well, and then imagine the future and then help create it. You know, the Blue Angels motto is, "The sky is not the limit." So watch your thoughts, for they become words. Watch your words, for they become actions. Watch your actions, for they become habits. Watch your habits, for they become character. And watch your character, for it will become your destiny. Thank you again, and congratulations to the entire graduating Good Samaritan residency class of 2020.
It is my great pleasure to introduce Drs. Keith Downing and John Bulo to present the Minimally Invasive Gynecologic Surgery Class of 2020. The Minimally Invasive GYN Surgery Fellowship Training Program began in 2017 and has continued to develop and flourish concurrent with the obstetrics and gynecology departmental growth in supporting education. The Minimally Invasive GYN Surgery Program supports quality education and patient care, maintaining a high bar for each fellow as well as encouraging lifelong learning for its graduates. A quality program, however, is not attributed solely to its leadership, but encompasses all who take part in and support the educational experience, especially the dedicated faculty, the clinical department leadership, and of course, the amazing trainees within the program. So without further comments, I would ask Drs. Downing and Bulo to present the Minimally Invasive GYN Surgery Graduate of 2020.
We would like to congratulate Dr. Eisner on her graduation from the Fellowship in Invasive Gynecologic Surgery. It's been a pleasure to work with Dr. Eisner for these past 2 years. She's been a tremendous fellow. I think one of the standout characteristic of Dr. Eisner is her willingness to challenge authority, or perhaps at least me. But I think she does so because she's coming from a place of real concern for a patient's well-being. And I think one of the reasons why I appreciate that about her is because I know it's about doing what's best for patients. She's now ready to take on independent practice. I think the most important word there is practice. So what is it to practice? So to be actively engaged professionally in a specified career or way of life, or to work at repeatedly so as to become proficient. So as you engage and you begin your career as a practicing clinician, the challenge before you is to take what you've learned here and continue to grow and develop as a clinician. And to do so, you will be your own authority. It'll be up to you to challenge yourself to continue to grow and better yourself as you continue to strive to do the best you can on behalf of your patients. So I wish you well on that journey. I know you will do well on that journey. And again, we congratulate you on this achievement.
Congratulations. Hi, I'm Isabelle Eisner. I'm the 2020 graduate for minimally invasive GYN surgery at Good Samaritan. Um, I'm excited to be finishing, although I've had a wonderful time and I've learned a lot over the past 2 years. I particularly want to thank Dr. Downing and Dr. Singhal for their surgical mentorship and general mentorship, and for making me a far better surgeon now than I was when I started. And I want to thank my co-fellows who made it quite a ride. Also, thank you to my family and my husband Caesar for being supportive always. I'm headed to Philadelphia to Temple University, where I'll be in faculty practice. I'm hoping to continue to apply everything I've learned here and help a whole lot of people. So thank you very much.
It is my great pleasure to introduce Dr. Pankaj Singhal to present the GYN Oncology Class of 2020. The Gynecologic Oncology Fellowship Training Program was developed within the Department of Obstetrics and Gynecology beginning in 2018 under the direction of Dr. Singhal. I am pleased to announce that 2020, having been the first of many things, is also the year of our first graduating class, consisting of one graduate who will be presented by Dr. Singhal.
My name is Pankaj Singhal. I am a GYN oncologist and fellowship program director for Fellowship in Gynecologic Oncology. I'm here to congratulate our graduating fellow, Dr. Nitin Wadhwa. Dr. Wadhwa started fellowship program 3 years ago, back in July of 2017, when he was naive, and I did not had experience with robotic surgery. And 3 years down the road, he is, I can say, he's a great robotic surgeon. A few things about Dr. Wadhwa. He completed medical school from Nova Southeastern University back in 2012. Thereafter, he went on to do residency program in obstetrics and gynecology at Arrowhead Regional Medical Center in California from 2012 through 17. And after completion of residency program, he joined us for GYN Oncology Fellowship Program. I must congratulate him, and he will go down in the history of CHS of Long Island and Good Samaritan Hospital as the only fellow to graduate from this fellowship program. And he can definitely claim to fame that he is the only fellow ever to graduate from our program. So congratulations. During his fellowship program, Dr. Wadhwa demonstrated exceptional leadership skills. He was the chief fellow, where he oversaw schedules for 4 different fellows. He also demonstrated excellent learning capabilities, not just in surgical skills, also in chemotherapy program. He developed chemotherapy program, multidisciplinary rounds, and essentially took over all complex chemotherapy administration in our division. I can imagine this 4 years or 3 years of fellowship program has been hard on him and also on his wife, who graduated from our minimally invasive fellowship program about a year ago. And this hard work dedication has paid off, and he's graduating from our program. I couldn't be proud of him, that what he has become in 3 years. And I keep telling him this is a journey, this is an ocean, and this is time to cut umbilical cord and start swimming. So again, congratulations. Dr. Wadhwa is looking forward to taking position in combination of academic private practice, whether in Florida or Green Bay. I always say it's a good problem to have too many offers from. I wish if he had stayed with us in our division as my partner and colleague, but I recognize that he's been too far and too long away from his son and his wife. So I don't blame him to be close to them. I'm certain that whatever Dr. Wadhwa does in his life, he'll be greatly successful. I have no doubts that I look forward to reading his publications, papers, and hearing about him in national meetings. I also should congratulate Nitin's parents, who have done such an exceptional job raising him throughout his career in medical field and supporting him. So just not Dr. Wadhwa, I congratulate him, his family, his wife, his son, and most importantly, his parents. So if I'm your father, I'm really proud of you, and I'm sure I just can't imagine how proud they are. So again, congratulations, and start swimming, start flying. Congratulations. Thank you.
Hi, I'm Nitin Wadhwa, and I just want to say a few words about the fellowship experience. So I want to thank all of CHS, all of Good Samaritan Hospital for all the support and for the fellowship program. It goes without saying, Dr. Downing has been part of the program as well with Journal Club, so I do appreciate all of those as well. And all the co-fellows over the past several years, I do want to thank them too. It goes without saying that family is very important, and for me as well, it's been very important. Without my family, of course, all these years of training would not have been possible. So I do want to extend a big gratitude to them. And as I wrap this up, I want to say a very special thank you to Dr. Singhal and to Pushpa, because without both of them, my experiences here would be very different. And their devotion to good patient care has allowed me to be part of this program and to be part of their gynecological care as well. So I thank you very much.
Congratulations, Isabel, on finishing fellowship. As my senior fellow, I've looked up to you throughout the whole year and hopefully for my extended career, because I was really blessed to have you as a co-fellow because we became really good friends, and I really value the friendship we had over the past year, and I wish you nothing but the best in the future. I'm going to miss enjoying and cracking jokes with you that only you and I get, but we'll still be texting back and forth, I'm sure, in the future, all of our little jokes. So all the best to you, and I wish you well. Ciao.
Okay, I'm Pushpa. I work with Isabel all the time. From 2 years I'm working with her. She's really a great doctor. We are going to miss her so much. She's really the excellent doctor. We congratulate her for her graduation, and we wish best of luck her. Wherever she goes, she has to rock down. She has to rock. We miss her so much, we love her so much, we respect her so much.
Hi, my name is Nadira. I used to work with Dr. Eisner, who is, I would say, she's the most sweetest and very sincere. We are here together more than 2 years, and she's the, we are gonna miss her. She did everything, whatever, we asked, she did timely fashion, and everything is like, she's the one, we're gonna miss her. She did great job here, and I wish her great success. Thank you.
Hi, just wanted to give a big congratulations to Nitin Wadhwa for finishing fellowship. Man, PGY 7. I can't imagine 7 years of postgraduate training, but you did it, my friend. You're a great example as a physician, someone who is very knowledgeable and fastidious in everything he does. I look up to you a lot, and I wish you all the best in your career going forward. Cheers.
I'm working with Nitin from 3 years. I know him from 3 years. He's really very good. He knows what he's doing. He's good in surgeries. He's really excellent doctor. We are definitely going to miss them so much. We wish them for their new journey they are going for. We congratulate them for that they are graduating from this program. We are definitely going to miss them so much, and the patients are going to miss Isabel and Nitin too much. Thank you so much for giving us opportunity to say something about them. They are both really the great doctors and the great mentors and great fellows, and we are going to miss that team very well.
Hi, my name is Nadira. So we work together. I'm talking about Dr. Wadhwa as a team for all the oncology chemo patients. So I worked very closely with him for last 2 years. He's a really responsible and sincere and wonderful guy. I mean, whenever we need anything, actually, whenever I asked anything, he was such a great help. And he's gonna be greatly, missed. And I wish him great success for his incoming future.
Hi, I just want to say thank you to Nitin and Isabel. We really appreciate you being here for us as well. I'm sure you appreciate us being there for you. We learned so much from you, and we wish you all the luck in the world. We're going to love you and miss you.
Hi, Dr. Nitin and Dr. Eisner. It was a pleasure working with you guys. You guys are great doctors, and I'm pretty sure you guys are gonna be even greater. I wish you nothing but the best, and I will miss you so much. Thank you.
Here at Good Sam ASU, we want to take and wish all of the fellows the best of luck in their future. It was a pleasure working with all of you.
And congratulations.
Congratulations.
Congratulations. We want to wish them the best of luck. It was wonderful working with all of them.
Yes, and hi Nitin and hi Isabel, and it's been great working with you. I know you'll do fabulous in your new careers, and Ruchi too, and we will miss you very much in the OR.
I think it was a privilege and honor that they were here, part of our family. I think it really did an incredible job, and we couldn't be more proud of them.
Yes.
What they have become in such a short
The
time.
whole fellowship program was
Yes.
Yes, it was
incredible.
absolutely wonderful, and we're very grateful for them.
And they're welcome to stay with us, take a job with us if they want.
Yeah. I can come back.